Hi everyone, my name is Allison Casey. I'm an associate marriage and family therapist here at Embracing You Therapy. Today I'd like to talk about the differences between suicidality and harm OCD. But before I get into these differences, I want to take a moment and say that if you or anyone you know is struggling with suicidal ideation, there is help out there. The Suicide and Crisis Lifeline has changed their number to 988. You can call or text this number as it is available 24 hours a day, 7 days a week. You can also dial and call 911 or get in contact with your local emergency clinic. Now, to begin, just very broadly, the differences between harm OCD and suicidality is intention. For suicidality, the thoughts are intentional and created. There is a clear plan, means, and intention, and these thoughts can bring pleasure or relief in a time where the person may not see another way out. For harm OCD, the thoughts are unwanted, they're intrusive, distressing, and are ego dystonic, meaning the thoughts do not align with the person's actual values or desires. Suicidal thoughts have many causes, and this can happen to anyone, whether the person is depressed or they're under extreme stress situations or they've gone through a traumatic life experience. Person who often gets or is dealing with suicidal ideation, they can experience a sort of tunnel vision where in the middle of the crisis they believe suicide is the only way out. Harm OCD, on the other hand, it's again a subtype of OCD where the person fears they are going to lose control and will harm themselves or will harm their loved ones or others. As I mentioned earlier in the video, the thoughts, more so the obsessions, they are intrusive, they're distressing, and they're ego dystonic. So common examples of obsessions are inflicting harm or pain onto someone you love or onto yourself. Oftentimes it would be having aggressive or violent images that pop up in your mind. The person can believe that they are responsible for inflicting any pain that others may face. So again, since we're talking and dealing with OCD, since these are the common obsessions, the common compulsions that we see in harm OCD revolve around reassurance seeking, mental reviews, mental rituals, as well as flat-out avoidance. So oftentimes an individual that is dealing with harm OCD will try to hide knives in their kitchen, or they'll try to hide basically any other item that they can use as a weapon. They'll avoid watching harmful content in terms of like violent movies or even video games. And again, oftentimes they will try to excessively confess to things to try to keep themselves accountable or keep themselves within a moral compass of okayness. So I hope this video shed a little light on some of the differences between suicidality and harm OCD. If you have any questions, please give us a call or leave a comment right below this video. And I hope you all have a wonderful day.